Good. So let's start because it's 2 minutes after 1 o'clock. And first of all, thank you everybody for joining us today. We're very excited to have the first session of the forum for 2024. My name is Montserrat Serra. I work at DMAS as the Civil Rights Coordinator. DMAS is the state agency, or full name is the Department of Medical Assistance Services. For those who might not be familiar with the agency, we are also called the Virginia Medicaid Agency, just because we administer the Virginia Medicaid program for the state of Virginia. I'm very excited today to have a large representation of community stakeholders and community organizations. Today, we will be sharing great tips and resources about language and disability access. And for those that don't know me or how I started with this initiative, just a few words to say that I started with the agency back in 2019 when DMAS had a need to hire a new position. It's something new that was not in the agency, which was the Civil Rights Coordinator position. So I've been with the agency close to 5 years, working on the efforts of language and disability access to make sure that members of the Medicaid program, applicants to the Medicaid program, they're able to access information, mainly those that are or that have disabilities or they are limited English proficient. We have developed a program to make sure that they can access our programs and services. And the reason why we're here today is because part of the initiative was to develop for the agency, for DMAS, a language and disability access plan. When we put together the plan, which is publicly shared in the DMAS website, we found some future initiatives. One of them was a forum or a way to engage with stakeholders and other organizations to work together and to kind of like find solutions to common problems and common language and disability access barriers. So that's how this initiative of the Forum on Language and Disability Access started. And we completed last year in 2023, 2 forums already. And for 2024, today you are attending the very first one. And our goal is just as a team, all of us, that we can collaborate together so that we can find and talk and discuss and find solutions to the common language and disability access barrier that our clients or members find when trying to access our programs. But let me move on to the logistics before. Well, yes, so here's a little bit what's gonna happen today. I just want to make sure everyone is aware that we have 2 American Sign Language interpreters. So those that need interpretation services, they can pin the interpreter. If you have difficulties, let us know, but the interpreter is being pinned, so it should be accessible by everyone. We also have closed captioning available, as well as cart services. Cart services are being provided by Hamilton Relay, and there is a live transcriber that is transcribing the event. One of my colleagues, Jesus, will be posting the link so that those that want to follow the event with closed captioning or live transcriptions can access that. Then, and again, I forgot to mention, but this is a good opportunity. Thank you very much to my team members, Jesus Perez and John Stanwicks. Without them, I couldn't do this. They are helping me on the vaccine and just taking care of any questions or any concerns that might come. So thank you very much, both of you, for being here today. We also have the chat that is available to everyone. If during the presentation or any of the presentations you have any questions that are related to the content, please put it in the chat. While I'm doing this presentation, I would also encourage everyone that has joined us so far, as we have a very diverse and large audience, I would encourage everyone to put their name on the chat, the organization that they represent, or who do they represent. I think this is going to be very helpful for all of us to know how diverse of a group we are and how we are all working together to make the language and disability access efforts easier for everyone. Let's see. An important item, if you experience any technical difficulties, there is an email that you can send any questions, which is the Civil Rights Coordinator at DMAS.Virginia.gov. Send us any concerns if you're running into any technical difficulties today. And without any further ado, let me go to the next slide, which I just want to take you on a very quick summary of what's gonna happen today. Usually our forums are 2-hour events, and they are formatted, or they have the same sections. We try to be consistent with that. We found that this is very helpful. We start with an opening keynote, and today we have Mr. Markva, who will be kicking the event, and then we will have a brief presentation. The presentation is going to be about translation, taglines, and implementation. That's going to be completed by me today. And the most important, or what I find very engaging section of the forum, is the panel discussion. Today we will have 3 speakers, and they will be presenting some very important information and very exciting information about translations and how they implement those for their agencies. At the very end, if you want to hold all your questions, Jesus is helping me collect the questions, and then at the very end of the event, we will address those that we have time to address. If there's any questions that we are not able to address because of time, we will post it later. Then at the very end, we will have the closing. And I also forgot to mention that this event is being recorded, so that please know that this is being recorded, and the recording is going to be shared at a later time once we have completed all the materials. All right, so let me introduce you to Craig Markva. He is our opening keynote speaker, and it is an honor for me to have him. When I first thought about inviting him over as speaker, I thought he would be so fun and engaging, and he's gonna inspire us. So I know how he has so much information that he can share with us, that it's gonna make us feel like our work is worth statewide. Craig Markva joined the Allen administration in the Office of Constituent Services, eventually becoming director. And in 1999, Craig began working at the Department of Medical Assistance Services. He served in various capacities, working up into the DMAS management team until Secretary Little asked him to join the HHR team and in the Youngkin administration. So Craig today is gonna give us a speech, and Craig, the floor is yours.
Thank you so much, Montserrat. And I will say, just taking in a lot of what Montserrat has just been mentioning, all the technical capabilities, this connection, all of the advances were all pretty much science fiction back in 2019. When you look back at it, it was all very aspirational. So it's nice to see that we've actually taken a giant leap forward. So just for perspective, you all, this is really awesome. But when I was asked to take part in today's event, I was honored by the invitation. It made me think about I was coming full circle back to this project's place of origin. As Montserrat already noted, back in 2019, she was hired as the first civil rights coordinator, and she joined a team of people, including Sarah Hatton and John Stanwicks, who are also on today, that they were quite familiar with the demands and requirements that focused on timely response to member and constituent inquiries, as well as appeals and eligibility questions. But frankly, we weren't really completely aware of the many factors that needed to be considered and addressed. We came to the realization that Virginia Medicaid was truly at the intersection of healthcare and civil rights. We recognize that our commitment to ensuring the meaning of the word of the phrase "no wrong door" was more than mere words. Some of the people coming to our door needed to be able to communicate with someone who could speak a language other than English. Maybe the person couldn't see or hear the person at the door, or even access the building or our shiny new website. To serve everyone, we were going to have to create a concrete action plan, establish agency-wide policies, and modify a system that had been around for more than 50 years. I started at the agency in '99, and since then, many changes, updates, upgrades to the program and to the organizational structure of DMAS have been made. Many of these changes improve the member experience, but we could never deliver all these services by ourselves. We had significant partnerships with sister agencies like DSS, VDH, and DBHDS at the state and local levels. We recognize no one agency can deliver healthcare services to more than 2 million people on their own. After beginning my new job in the office of the Secretary of HHR, Secretary Littell stopped by my office in the midst of a chaotic session to tell me that once the 2022 session was over, I needed to research the progress HHR agency had made in addressing the federal requirements regarding language and disability access. While most of the agencies had done something, our goal as an HHR team was to cross the finish line together, and that's going to require a focused effort to assess and assure all HHR agencies had a plan to address these specific needs. Our colleague, Terry Morgan, Executive Director of the Board for People with Disabilities, was a huge help in providing us with valuable advice and insight on how to get a project of this size off the ground and build something that would address the many needs of the various populations we all serve. We eventually entered into an agreement, VCU Partnership for People with Disabilities at the end of '23, and eventually with McKinsey & Company. In February of this year, we kicked off the HHR Language and Disability Access Project to determine and to demonstrate that the Commonwealth of Virginia is committed to ensuring language access and reasonable accommodations for citizens with disabilities and limited English proficiency. Our goal is not to just align our programs with federal and state laws, including the Civil Rights Act, the ADA, Patient Protection and Affordable Care Act, but to aspire to enable Virginians to readily and easily access information. By mid-March, all HHR agencies had completed a landscape assessment that provided us with an appraisal of each agency's ability to deliver meaningful access and opportunities that need further development. Shortly after this landscape exercise, we began a deep dive of both DSS and DBHDS. This included meeting with agency leadership as well as visiting local agency sites across the Commonwealth. We also included interviews with people with disabilities and limited English proficiencies. These lived experience interviews with people who access services included SNAP, TANF, Medicaid, child support, early intervention, DD waiver case management, mental health case management, and crisis services. The team held nearly 50 in-person and remote interviews. They spoke with people on the front lines, local agency staff who serve people, who thoughtfully engage with the team, and stakeholder groups that support and advocate on behalf of individuals with limited English proficiency and disabilities. The team also spoke with 20 Virginians who either need accommodations themselves or whose loved ones need accommodations to navigate the services. When a local CSB leader shared their perspective on the criticality of American Sign Language and language interpreters being trained to support individuals with behavioral health needs. They've taken steps to ensure that trauma-informed contractors are prepared to adequately translate to ensure individuals can be connected to the services they need. We heard from an immigrant with a son who has severe autism. He told our team he felt he was the luckiest man in the world when their local DSS worker connected them with a Spanish-speaking caseworker. He said, quote, We were lucky. Most people struggle, have no idea what to do or where to go. Having someone speak our language is the only reason we were able to get services. These two experiences may be the exception, but the goal is for them to become the standard. Accommodations being available, provided consistently, no matter who you are or where you live in Virginia. We're currently in phase 3 of the project, working with each HHR agency with an individual implementation plan to oversee the improvement of accessibility for Virginia residents in both the short and long term. But I don't want to end this introduction simply projecting an image of rainbows stretching over a field of flowers filled with playful puppies. I feel I must at least mention the F word, that most dreaded word issued by lawyers and auditors to public servants on a regular basis. That word is finding. Even as we continue our work, we don't want to suffer state or federal consequences, which could result in even more punitive actions and require additional work that would just frankly slow down our efforts. Our collaborative efforts will yield good fruit and we will succeed in this endeavor. And I can tell you right now that this will be one of the projects that will live on. I can think of a lot of projects that I worked on at DMAS over the years that 5 or 10 years later were changed and we made other adjustments, but I can tell you right now that this effort will have a lasting effect and impact 5 to 10 to 20 years down the road. So I know today's presentation and sharing between panelists will help all the organizations here today improve their programs. So thank you for your commitment as public servants to the goal of providing access for all Virginians, regardless of their native language or disability. Thank you. I hope you enjoy today.
Thank you so much for those words. And as I said, you are an inspiration. I believe you have been in your position, your current position, what has it been, a couple years now?
Yeah, 2.5, you're coming up on 2.5 years, yeah.
And the work that you have already completed statewide with all the state agencies under your umbrella, it's amazing. We are, I don't know if everyone is familiar, but the HHR agencies have been working together with the Secretariat's Office on the Language and Disability Access, and that priority has been placed on all these agencies, and everyone is collaborating together to make it happen. And it couldn't have been done without Craig. So I appreciate.
Thank you so much. That's very kind of you. And I haven't done this all by myself. So I really did. The people I named, Montserrat, John, and Sarah, really, and Terry really helped pull me across the finish line in many ways. So and now a lot of other agencies have been coming on board, and it gives me great hope for us completing this task. So it's not going to happen overnight, but again, it's been really good.
Yeah, thank you for making.
I'm so sorry to interrupt. Apparently, my team interpreter is here. Her name is Amanda Horton, but currently her camera is blocked, so she's not able to take her turn, and it is time for her to take her turn.
Yeah, Jesus or John, are you able to see her on the list of attendees and bring her? Let me see if I can. Amanda. And then I have Zoe. Also, Zoe would need to be brought into as a presenter.
Oh, she's listed as interpreter Amanda.
Oh, perfect. Thanks for that tip. So Jana Jesus, if you could find her, let me know if you're not able to do, because I should be able to bring her in. Okay, I think she's.
I did find her, and I made her a presenter. So the next thing is getting her on camera. Perfect.
Well, after the inspiring words of Craig, we are gonna move on to our presentation. And the reason why we're putting together this is because there's so much work that is being done in language and disability access. And most of us, including myself, we were brought into this initiative without having much knowledge on how we can implement all these programs and services. So one of the reasons why I'm having this presentation is that we can all learn from each other. There's so much work that we are doing today, and it's so helpful when we hear stories about how others are implementing all these efforts. So today my presentation is going to be about translation, taglines, and implementation. First of all, let's see if I can, okay. So just a quick overview of what we will be presenting today is the language and disability access service requirements. And those are, again, what's going to apply to our agency. Each agency might have different requirements in regards to language and disability access. We will also provide information on the DMAS approach to language access, how some of the data that we have collected, we can see the increasing trend of non-English languages. I'm sure some of your agencies have started experiencing that trend. We will present how we have created system-generated notices for the Virginia Medicaid program in non-English languages. We will also walk you through our process with ad hoc translations at DMAS, and the behind the scenes will take you over behind the scenes of a translation implementation that we have completed for the Virginia Medicaid program, and also show you some examples on outreach materials. At the end of the presentation, we'll talk about taglines. If you're not familiar with the terminology taglines, hopefully after this presentation, you will know what those are. And if you're familiar, you might have a little bit more information that you might not necessarily be aware. But yeah, we will discuss what taglines are, what's the purpose, and show some examples and how those taglines can be implemented. So let's move on to the requirements. And let me see. All right, so right here, we have the legal framework in providing language and disability access services. And understanding these laws is very important to ensure that our services are not only effective, but also compliant with federal regulations. Again, please note that today I'm just giving a general overview of the authority within the healthcare setting, which is the setting that Virginia Medicaid operates, and that each of your organizations might have different authorities. We suggest that you consult with your counsel for specific advice on what could apply, but this is the main framework. As most of you are aware, Title VI of the Civil Rights Act of 1964 was the fundamental law that prohibits discrimination on the basis of race, color, and national origin in programs and activities receiving federal financial assistance services, such as our agency, the Department of Medical Assistance Services. Its implications for language access are deep, as it covers situations where failure to provide access to individuals who are not proficient in English can be seen as a form of discrimination based on national origin. That's why this law is the main frame that we operate as far as non-discrimination when we facilitate our programs and services. Another important law is the Executive Order 13166, which was issued to reinforce Title VI. This executive order specifically addresses language access, and it mandates that all recipients of federal funding must take reasonable steps to provide access to populations with limited English proficiency. This ensures that no one is excluded from any important communication, and there's no language barriers for them to access important information. Moving on to disability access now, with Title II of the Americans with Disabilities Act requires the state and local governments to provide appropriate auxiliary aids and services to ensure effective communication with individuals with disabilities. This is a very important piece of our approach to disability access, as it emphasizes the need of adapting our communication to meet diverse needs. Section 157 of the Affordable Care Act builds on the previous regulations by specifically requiring covered entities to take reasonable steps to ensure meaningful access to their programs or activities by LEP individuals. It is detailed in this 45 CFR if you're curious to find more details. But this one outlines the obligations to provide language assistance services, such as interpreters and translated materials. But it will be very important that we emphasize the increase of language of different non-English languages trends. So I put together these comparable chart. On the left, you have the Virginia Medicaid language count data for the past 4 years, from 2020 to the recent most available data that we have, which is in 2023. And then to the right, I put a chart where you can see the increase of languages, non-English languages, within the Virginia state. I found these two comparables were very important. As you might see, and if you're not able to see the data very close, but for example, for the Virginia Medicaid language count, we can see that in 2020, we had over 95,845 members of the Virginia Medicaid program that spoke other languages other than English. And in 2023, we have 148,023 individuals that have reported that they speak a different language than English. So it is a pretty significant increase. Very similarly, we can see that trend in the Virginia languages that are spoken. And in 2020, there were 1,311,000, over 1,311,000 individuals who spoke other languages. And in 2022, 1,355,000 approximately individuals that spoke other languages. The reason why I wanted to showcase this data is just because I wanted to illustrate that there is a need, not only with the Virginia Medicaid program, but in general for the state of Virginia. There is a need to assess opportunities to provide language access as the population continues to increase. So it is important that we continue to meet and we continue to put efforts to address barriers that these individuals might encounter when they're trying to access programs and services. The next slide that I put together with some interesting data, it is based on the language counts, and this one is broken down on the specific languages that are most frequently used in the Virginia Medicaid program. And you'll be able, or I can read to you some of the numbers. The Spanish speakers are the most frequently used, the most frequent population besides the non-English, and we have over 112,000 individuals in the Virginia Medicaid program whose preferred language is Spanish. The next most frequently used language among Virginia Medicaid is Arabic, with over 5,000 individuals. And we have then Vietnamese. Vietnamese language is spoken among Virginia Medicaid members for a total of close to 4,000 members. Urdu is the next most frequently used language with over or close to 2,000. And then we also have Amharic with close to 2,000. So when we were assessing the language landscape with the Virginia Medicaid program, that was an initiative that started happening before I even came into the agency. It was determined that it was a priority that we wanted to communicate with these individuals in their own language, in particular for information that is very vital to accessing their services. Those communications are, for example, eligibility notices where they are being informed if they qualify for the Virginia Medicaid program or if they need to provide us with additional information. So the agency, DMAS, made an effort to ensure that those communications for those individuals that are among the 5 top most frequently used languages were able to receive those notifications in their own language. Again, those are very vital communications that members receive, and if they don't understand or they don't know how to access that information, it might represent that they might not receive coverage that they might be qualifying for. So it was, again, something that the agency put great effort. It's been a process and an ongoing process because these notifications get updated constantly, and we continue to update those notices in those languages. In the future, our plan is to offer more notices in additional languages. And stay tuned for when that's going to happen. But for right now, a significant amount of our Medicaid population is able to access those notices in their own language. So let me bring you into a little bit how we apply or how we complete translation work. As I mentioned before, our unit is composed by Jesus Perez. He is our civil rights coordinator specialist, but he also very fluent in Spanish. So any in-house translations that we handle for our agency, most of them or pretty much all of them are completed by Jesus. And I wanted to illustrate to all of you what's the process that we follow when we have a request in-house to translate materials. And these materials for our agency might represent, for example, flyers about eligibility limits for Medicaid, or brochures about a new coverage that Virginia Medicaid is offering. Or it can represent a lot. Jesus works a lot. We work a lot with appeals, and a lot of the final decisions that we send to members, they are requested in Spanish. So we do a lot of that work as well. So how it all starts is, first of all, we receive a translation request, and that comes into our mailbox or to an email, and we receive the original English version of the material, and then our translator will complete that translation in Spanish. It goes, once the translation is complete, it goes through a quality assurance. So in this particular case, I overview that translation just to make sure there's accurate, there's no any issues or concerns, that it also follows the glossary that we have for the most or the general terminology that we use at DMAS. We try to stay consistent with the same terminology. And once that is being reviewed, then it is sent to for formatting. So if this is something that had, for example, images or something like that, then it's sent back to the person who puts it all together and makes run their magic to make it all look pretty. And eventually, once is that put together, we do another quality assurance to make sure that all the information lays out correctly, and then it's sent for publication and distribution. So this is how we handle translations at DMAS for Spanish. So what happens for other languages? Well, for other languages, we work with an outside vendor. The system is pretty similar, but most of the translations that we work can be in any language that we are asked. And we receive the same. We have trained our DMAS staff to submit those requests to our request mailbox or send those to us. They send us the original version of the flyer or the notice or the letter in English, and then we work with our vendor, outside vendor, and request a quote. So we send them the material that needs to be translated. We give them the information about what language needs to be translated, and then we receive a quote. That quote is then reviewed by our unit, and once that quote is a go and approved, then it's sent to the vendor so that they can proceed with the translation. And then once that translation is complete, the vendor submits that translation back to us, and we provide it to the person at our agency that has requested. So this is how it flows. Usually we are pretty quick at handling Spanish translations. That's why we love to have someone in-house. And because it's also the most frequently used language, we like to have that flexibility to have a quick turnaround. For outside vendor, it might take sometimes additional time, but it's important if you work with an outside vendor that they give you a realistic timeline on how long it can take to complete a translation, so that you are prepared to have it ready for the person who requested, even if it's a member or a client or it's for your own DMAS staff. So I thought this would be very interesting for you all to share. Later we will have a panel discussion, and I'm looking forward to hear what other agencies, how they handle the translation process. But let me move on to another secret that we want to share with you all today about how DMAS handles translations. And I just wanted to bring you over behind the scenes of translation work that we have recently completed. And this was for a renewal, a Medicaid renewal for a specific service. And I wanted to show you, and those that have maybe difficulties seeing, as this might be small, but to the left side of the slide, that's how we receive the notice. This is a screenshot of a notice that we received that was in English, and our team told us we need this notice to be translated in additional languages. So what we usually do is we break down the information that is in English, and we break it down in different lines. So when we send it over to have it translated, then we can just ask the linguist, place the translation of a particular sentence or particular piece of information on this column under Spanish, and then we put another column where it's Arabic or whichever language we need that translated into. So that way the linguist can put that translation into the appropriate line. The reason why we break down like this information, and this might be helpful for some of you that work with translations, is because sometimes some of our notices are sent to programmers because those are notices that need to be sent to different members. So there's some content that is in the notice that it's applicable just for that member. So the programmers, they run their magic and they put the information where it's supposed to go, so that when the member information populates, it populates correctly. So that this is the reason why we break it down like that. And I thought that maybe you would find this interesting on how we perform the behind the scenes translations here at DMAS. And now let me show you an example, a sample of one of our translations jobs. And those that might have difficulties on seeing what we are presenting today with this slide, I wanted to mention that we have different translations of a flyer that we recently work with, and we have the English version, then we have the Spanish version, the Amharic, the Arabic, the Urdu, and the Vietnamese. So this particular flyer was in collaboration with our outreach team at DMAS, and they asked us to complete the flyer in different languages. So they sent us what you can find on the English site, and then we just outsource the other languages, and the other languages were provided back with the translation. Again, this flyer in particular has some graphics, so we also work with our graphic designer here at DMAS to make sure that all the information when it was translated, that was flowing correctly. I also wanted to emphasize that when we work with our graphic designer, we make sure that these flyers are accessible, meaning that once they are uploaded, because some of them are uploaded to either the Virginia Medicaid side, the DMAS side, or the Cover Virginia side, we make sure that these flyers are accessible to screen readers. So our graphic designer has knowledge as well as how to make sure that these flyers pass the accessibility standard. So this is a very colorful example. I thought it might help you understand what's all involved with the translation and how many pieces literally have to happen, because it's not only the translation, but it's also putting together the graphics, making sure that also the translation is accessible to screen readers, and then publishing it in the DMAS website or the Cover Virginia site, which is in this particular example where this flyer was or is currently being housed. All right, so let's move on to the second part of this conversation, which is going to be about language taglines. If we were in person, I would be curious to ask, or if you are in the chat and you want to respond, I'm curious to find out how many of you are familiar with language taglines. It is kind of like a technical word, but basically, let me move on. Sorry, I just need to navigate. But basically, language taglines, and I put here a sample of one. Yeah, I saw. Can you confirm, Jesus, that you are seeing slide number 13? I saw something popping up. Just want to make sure everyone. Okay, perfect.
Yes, I can see it.
Okay, great. Thank you. I just want to make sure everyone is following on the same slide that I'm in. So language taglines are brief and clear statements that are included in written communications, and they indicate the availability of language services in multiple languages and alternative formats, such as large print or Braille, etc., etc. For example, the language tagline that we have included in this slide says is sent with Medicaid notices, and what it particularly says is you have the right to get this letter for free in your language, in large print, or in another way that is best for you. So this is the sentence that we then translate in the 15 most commonly used languages in Virginia, so that anyone that is not able to access the information, they know where they need to call if they need to have this information translated, or they need someone to explain to them in their own language what this information is about. So the primary purpose of these taglines is to ensure accessibility and inclusivity. They notify users not only that the services exist, but also that they are readily accessible. And by informing inform the recipients of their options for language assistance services. Taglines help remove language barriers that can prevent individuals from accessing vital services. They ensure that all community members, regardless of their language proficiency, have equal access to important information and services. So this is, in a nutshell, pretty much what language taglines is. And with our Medicaid notices, we make sure that we include all these taglines as an appendix to any communication that we send to members. So any eligibility notices that are sent to them, any appeals communications, we include this appendix. So if someone is not able to access that information, they can request to have it in their language. And it also, if someone needs the information in a different format, let's say large print or Braille or any format that is best for them, they know that they can call us and they can request to have that information in whichever format works best for them. So if we would not include this information, most likely people would not be aware of this service that is free for them, and it's that they're right. So this is a great way to make the public aware of that service to them. All right, so where these taglines come from, you might be wondering, right? We didn't make it up. And when I started working here at DMAS 4 years ago, it was the first time that I heard about taglines. And the reason and how I heard about them, it was because it was part of a requirement and a regulation. So I thought it would be interesting just to showcase a little bit what's behind the requirements on language taglines. And I started putting a list of some of these requirements in the healthcare setting that require these taglines. For example, under the Affordable Care Act, that's where I believe that's where it all started, where the requirement was placed that healthcare organizations, they were required to include these taglines in the top 15 languages in their own state, just to ensure non-discrimination and enhance accessibility. Then there is also another CFR, the 42 CFR, that one mandates managed care organizations. Virginia Medicaid, we work with a lot with managed care organizations or health insurance. So it requires them, if they work under the Medicaid program or any federal funded program, to also provide taglines in the prevalent languages to aid understanding of critical health information for LEP individuals. There is also another CFR or another regulation, 42 CFR 435.905, that states that says that states must provide Medicaid communications with taglines in prevalent non-English languages. And also another regulation which ensures the CHIP related information, which is a Medicaid program as well. It requires to include also the taglines in the prevalent non-English languages to maintain accessibility. So you can see here where this whole concept of taglines came in. It's important to know that under the Affordable Care Act in Section 157, there was first a requirement to have the taglines, and then eventually in 2020, there was a final notice where it reduced the need to include language taglines requirements. But then eventually, and very recently in May 2024, there was a final rule to the Affordable Care Act, Section 157, where it reincorporates again the mandate of the inclusion of language taglines. So if you think that that's something that you can implement for your organization or for your communications, require or not require, language taglines are very helpful. I think they make a difference so that individuals know that they have to write to access their information in their language, and they know where or how they can get that service. So you might be wondering, where else can language taglines be implemented? And as I mentioned before, we implement them in all of our written communications that are vital to our members. But so that would include the notices, but they're also implemented in our website. So if you go to the Cover Virginia website or the DMAS website, you can scroll down to the bottom and where you find the most relevant information, and you can find how to access the information in different languages, and then you access the language taglines where it informs the public how they can obtain language services or how they can obtain disability access services. Another place where we provide taglines, and maybe if it's not a long document, if it's even a small marketing material, sometimes we also put like a small notices. For example, se habla español, for those that want to make sure that the flyer informs individuals that if they have a need to communicate in Spanish, they know where to call if they're not able to access that flyer in their language. Or we also include a small tagline in Arabic, or whichever is the most frequently used language in that service area, where they can reach out to contact for additional services for languages and disability access. So these are some examples of where language taglines may be used. So we are at the very end of the presentation, and before we move on to our panel discussion, and again, I'm looking forward to talking with other agencies about how they implement translations and taglines, but I wanted to just finalize with some of the key takeaways that I have presented today. So first, we presented the importance to compliance to legal mandates and how it is the laws and it's part of the regulations, but not only because it is the law and regulation, we provide these language assistance services, but we also do it to protect the rights of individuals and ensure fair access to service for everyone, including those with limited English proficiency and people with disabilities. Second, I wanted to get out of this conversation by understanding how it goes beyond legal compliance and how it's all about accessibility and inclusivity. When I study my graduate degree, which was communications, I found like this is so relevant nowadays, because when you study communications, you want to make sure that what you communicate, it makes it to the other line, right? So this is how important it is that just because we communicate information, if we don't ensure that people can access that information, it just doesn't have any usage, right? So this is why it is so important that we ensure that there's language access and disability access, because otherwise, what's the point of communicating something if it doesn't make it to the other line? And lastly, another key takeaway is the public awareness and how important it is that individuals and the public knows how it's the right to have their information that they can access, and how important it is, and that through effective communication strategies, including the use of language taglines in all our communications, we can inform and educate the community about these resources, and just to ensure that more people take advantage of them. So this is the end of my presentation, and as I mentioned before, if you have any questions related to the content today, please feel free to put them in the chat. My colleague Jesus is collecting those questions, and we will take some time at the end to address those. So keep them coming. If you have any questions, feel free to put them in the chat. All right, so we're gonna move on to the next session, the panel discussion. Let me take a quick look if we have everybody here. So yes, thank you. Thank you, Zoe. Thank you, Guadalupe. Thank you, Anna, for being here today. Let me do the formal introduction to the panelists who will be having a discussion with me today about how their own agencies approach translations, language taglines, and strategies for identifying frequently used languages. Today we have Guadalupe Lucero, who is the Language Access Specialist for the Virginia Department of Behavioral Health and Developmental Services. We also have Zoe Aquino, I'm sorry if I mispronounce, who is the Policy and Communications Team Lead for the Hamke Center. And lastly, we have Ana Trigueros Merritt, who is the Translation and Interpretation Manager for the Virginia Department of Health. Thank you everyone here for being today. For those who are not familiar with the panel discussion, what we will present is 5 questions to the panelists, and we are gonna ask them to each of them respond how they feel they can share information with us that can be relevant, and how they can give us pretty much ideas so that we can implement in our own agencies, or even for the public, so that they know and they are aware of how their agencies are working with language and disability access efforts. So let's start with quick introductions. If everyone wants to introduce themselves, I will call your name, but yeah, if you want to share with you who you are, what agency do you work with, and I would also be interested, and I think everyone might be very interested in how did you get to this position here, because as far as I know, a lot of our positions are brand new. So I would be curious, and I hope maybe the audience is also curious to learn how do you end up with this position at your current agency. So yeah, let's start with Guadalupe. How are you, Guadalupe?
I'm good. How are you?
Good. Thanks for being here. Thank you so much.
Yes, thank you everyone for the invite. Hello everyone. My name is Guadalupe Lucero, and like Montserrat said, I serve as a language access specialist for the Office of Behavioral Health Wellness, which is a DBHDS office. So my office does prevention services. We have gambling prevention, adverse childhood experiences, suicide prevention, youth cannabis prevention. We are the Office of Prevention. So majority of my role is assisting as a subject matter expert throughout the agency, and also just within the community service board. So providing any kind of training, any kind of translation assistance, funding assistance, just anything surrounding language services. If anyone has a question, if anyone needs some guidance, they can come to me, and we help them with that, specific to our 40 community service boards, which I see many are on here today. I'm so glad that you are able to make it to this panel. How did I get here? So I actually was I guess my whole career around language started at VCU within the SETI program, which is the Spanish English Translation and Interpretation program. That kind of piqued my interest to wanting to help our LEP populations in the state of Virginia. And from there, I went on to working at VDH as a COVID admin specialist at the very beginning of COVID, of the pandemic, in which we did a lot of translations for instructions on whether you tested positive or negative for COVID, lots of interpreting, providing results to our community members. After that, I went on to work at VDH at the Office of Epidemiology alongside Anna. We both served as Spanish translators, in-house Spanish translators for the Office of Epidemiology. And then after that, I transitioned over to my current role, and I have been here for 2 years at this point. And it's been a great time, and I'm very happy to be here. So I guess whoever goes next.
Yeah. If you want to go next, this is Zoe.
Sure. Hi, I am Zoe Aquino. Yes, I am at Humke Center. I am the Policy and Communications Team Lead. And our mission at Humke Center is to organize Asian Americans towards social, economic, and racial justice in Virginia. And I think, as Montserrat kind of noted in her presentation, many of the top 10 and top 5 languages in Virginia after Spanish are Asian languages. And so we really came into this role because of the community members and service recipients we work with in our services and advocacy work. And I am excited to be working with Virginia state agencies to help our community members access the resources that they need to live their life. So thank you so much for inviting me here, and I'm extremely excited to be speaking with you all and hearing from you all. So thank you so much.
Thank you. Anna, tell us a little bit more about you.
Hello, everybody. Thank you for having me. I'm super excited to share what we are doing at VDH. My name is Anna Merritt. I am the Translation and Interpretation Manager for the agency. Our mission is to be sure that to promote and protect the health of all, and the well-being of all people living in Virginia, regardless of the language they speak. I landed in VDH in 2020, first as a COVID-19 investigator, bilingual, and then I became the first translator, in-house translator at VDH at the Department of Epidemiology. Then Lupita joined us, Guadalupe. And then I became the translation and interpretation manager for the agency. All these efforts has to do with creating our linguist access and disability plan. Is part of the effort of VDH to be sure that the services and the resources are ready for or the community or our members, regardless of the language they speak.
Thank you, Anna. Very interesting how I see a common trend among all of us, right? We have some skills with a language, and then eventually, from what I feel it was a priority for the agency, we got moved on to other roles that in the past didn't exist, but roles that involve making sure for all languages, not only the languages that we are skilled with, to make sure that it's translations availability and also individuals can access with other languages besides the languages that we are skilled with. So very interesting background. Thank you for sharing, and thank you for being here today. I think it's going to be a great discussion. So the second question I have that you can hopefully give us some insight so that we can learn more is what strategies have you found most effective in identifying frequently used languages within your area of service. And for example, I share during my presentation some of the data that we have collected for the most frequently used languages. This is information that we collect at the time of Medicaid application. So we ask members to let us know if they speak another language and if they would like to have communications in another languages. So that is something that has helped us identify the most frequently used languages, and that's how we were able to share the data before. But I'm curious, Guadalupe, do you follow any particular strategy to understand which are the most frequently used languages in your organization?
Yes, so in my office, we work with the 40 community service boards, and as I mentioned before, we do ask people to fill out some kind of requests. So upon requesting a translation, usually we know what languages there are. So as of right now, we kind of have a database of what has been requested so far. If not within all the 40 community service boards, a good amount of them have requested translations before, so we have that data. Now, on the facility side as well, I know that they have a process when receiving calls or when interacting with people as to what languages are available. So I can just usually ask our DEI officer and they would know what the top 10 languages are for this year based on data that they have collected as well.
Excellent, excellent. And probably even if it is just to run an Excel spreadsheet, right, with all these information, it just might be helpful, right, for anybody. Great. Great. How about Zoe? What strategies does your agency use to identify frequently used languages?
Yes. So we are a community-based organization and we're a 501c3 nonprofit organization. So the strategies that we typically use, it's a mix of strategies. Externally, we typically will partner with other services organizations like us or our county and state agencies, mostly because the Asian American community is incredibly diverse. There's over 100 languages, even just in one section of our community, one geography alone. So we as an organization cannot possibly identify each individual person's needs. So it's best to, and we shouldn't be, right? Like there should be other people that are working on this to cover such a wide area. So, and we want to make sure that we acknowledge their work. So we'll typically do outreach to other organizations and then also our county and state agencies to see, internally, we'll also audit our service recipients as well as our advocate base and see what languages are coming to us so we can figure out, are there any languages that we're missing or any languages that don't match our geography. So our office in Northern Virginia, let's say, if we're seeing, let's see, primarily just Korean and Vietnamese, why are we not seeing, let's say, Urdu or Arabic, right? Like, is there something missing? So it's mostly about trying to figure out what our community looks like and what we have and what we don't have, so we can not only inform ourselves as an organization, but inform other organizations and help support each other. And if one organization can't support, is that something we can support and vice versa? So those are some ways that we've done this. And we also, of course, take community member feedback. So if we're doing outreach and we find that people are interested in anything we're doing, but would need the language service, or in reverse, if we see that there is a large predominant community, we can provide the we can try to provide the language itself and see we can see how, if that is encouraging for community members.
Great. Thank you. Thank you, Zoe, for also reminding all of us that it is important to understand the languages of your community so that you can prepare, right? So if you have a most frequently used language, then perhaps you need to target your marketing materials for that population and translate those materials for that particular language. But I'm sure that Anna has a lot to share about how they track the language and how the landscape of languages is completely different at their local level, right, Anna?
Yes, that is correct. VDH is composed by a central office in Richmond, but at the same time, we have 35 local health districts that serves a very, very diverse population. And the needs of our population varies tremendously from the Eastern Shore to the Central Shenandoah local health districts, for example. So what we do, obviously, the first thing to get data and to know what languages are more used, we use first of all our language assistance services, right? So we track the language assistance and monitor the language most requested. We also, as part of our language access and disability plan that is in progress right now, we do consultations with our community stakeholders and the input from our staff members that serve and interact directly with the community. We also get information from our community outreach. And obviously, we have to use as well demographic data analysis. And I want to be very clear that even we could say that in Virginia, we have the five more common language that could be Spanish, Arabic, Vietnamese, Korean, and Chinese. That number, that priority of the language will change tremendously from one area to another one. Like in the Eastern Shore will be Haitian Creole, very, very like the number 2 request. Maybe in the Central Shenandoah will be Amharic, Ukrainian at this moment. We have to remember that Virginia is a refugee state, and we have certain areas that the demand will change depending on the global events.
Yes, thank you, Anna. Thank you for sharing this information. Very, very helpful to understand the different landscape for all the different areas in Virginia. I appreciate all the knowledge you're bringing to the discussion. And let's move on to the next question. We have introduced or we have discussed language taglines as a method to make the public aware of readily, sorry, I always have a hard time with this word, language services. But I'm curious to learn if your agencies use in particular this strategy of using taglines, or if you have any other way to inform the public of available language services and also available alternative methods of communication. So let's start with Guadalupe. If you can share information about how your agency handles that information to the public.
So currently our agency doesn't have a language access plan, so it's not specifically out in a plan how you can access these services. However, we do have a language line, and if people come to me for translations, I'm able to let them know that we have the assistance, and I'm constantly sending out reminders and announcements throughout the community service boards to let them know that this is available. And each community service board tends to have their own kind of system for finding language services. So it's all just based on a language access structure that we still need. But at the moment, there isn't anything concrete on how to inform the public of it. It's more of through the grapevine, people hear that these things are available. But we are working on trying to get a better structured plan and make sure that this is readily available and accessible to the public.
Yeah. Thank you. And I'm sure you get a lot of work just by communicating to your partners that you provide the language services. So just because it's not a specific tagline, I'm sure that the information is out in the community about the availability. So thank you. Thank you for sharing that. All right, Anna, how does VDH make the public aware of language services?
As well as I said before, our language access and disability plan is in progress. We have not yet developed a very consistent tagline. However, one of the first things we have done is provide our centers, all of them, with the ISP posters and flyers for ISR staff. The ISP posters is those posters that will show as you get into our facility that will tell you, I speak this language, and you have the option of, I believe there are 60 languages in these posters and flyers. Sometimes our clients do not speak any English, and so they point to the language in the flyer. The staff can get the information, the help they need through calling the language line or a video remote interpretation, whatever the case is. And it shows clearly that it's at no cost to our client. VDH will be provide this service for free. Perfect. Also, it's important to know that these taglines are going to vary depending on the communication. So if it's a website, it's going to be one way. If it's a flyer, if it's a message on your phone, all these things, we have to accommodate these taglines to the type of communication.
Yeah, very important point. Zoe, how does your organization handle making the public aware of language services?
Yes. So for us, we will typically advertise the services ourselves. So we'll do on-the-ground outreach. We do person-to-person community outreach, hotspot outreach, and we will let anyone in our community know that Humke Center can provide X amount of languages or can provide translation and interpretation or services. So for example, we also provide it through our materials that are translated, so that in and of itself is kind of informing and advertising that those language resources exist. So for example, we do nonpartisan voter outreach to let people know when elections are coming up and where they can go to vote. So we will have that information in, I think, 4 or 5 different languages and link it to a website that also has 4 or 5 different, those same 4 or 5 languages. In addition, when we have our in-person services events, we will do our best to have the flyers available in those languages that we can provide at the event. And otherwise, we will also, like I said, we worked with those other community organizations and local and state agencies, and often we will kind of send information through their through their listservs, so that it's an additional resource, right? So if those state or local agencies or community organizations face a language that they can't support, they can come to us. Or if we're doing, let's say, like a large Medicaid sign up clinic, which we've done, we can send out information to, let's say, like a Spanish speaking or Spanish language organization, and work together to sign people up together, but cover that larger population together. So those are the biggest ones. We also do, we call them ethnic media ads. So for example, in Northern Virginia, the Korean language newspapers are really popular thing for Korean households. And in addition, there are language specific social media in different Asian cultures. So again, using Korean as an example, they have, there's Kakao Talk, which is an app. It's an app and forum site for Korean language. And then there is also WeChat for Chinese specific language. So knowing those apps exist as well, that's another way to let those specific languages know that there are services and resources available.
Great. You guys have sure a long list of strategies, and I hope that everyone finds it helpful. I can see the common denominator of working with other agencies for awareness to let them know. I can see good ideas on learning about your population and how do they access information, so that you can inform in that media the type of language services that is provided. And so yeah, these are all amazing strategies. I hope this is helpful for the audience to pick on some different ways on making the public aware about language services. So let's move on to question number 4, and we have a few more. So we hope that this information you find it helpful. But this one is going to be very interesting. I shared before how at DMAS we handle translations requests, and I'm just curious for each of you if you can share any insights into what are the steps involved when you complete translation process or translation work at your agency. I'll be curious to know from the request of the submission to the final product, how do you handle those translations? How do you ensure translation accuracy, which is very important in the process? And if you can share any of the most common languages that you usually translate into, although that information has been shared before. But yeah, let's start with Guadalupe. If you want to share some insights on how a translation request would be handled by your agency.
Yeah, so when I came into this position, one of the main things was to try to create some kind of a structured system for requesting translations. And eventually we'll get to requesting interpreters. But for now, we started with requesting translations. So the first thing I did was create a SurveyMonkey forms, or any kind of form, Microsoft Forms or Google Docs. It's very, very helpful to getting all the data in one place, centralizing it. So that was the main step at first. So I created one survey for DBHDS staff, and then one survey for community service boards and their partners as well, because we do extend the funding to their partners. So what they do is they have a link, which I have shared with everyone. And if someone emails me and they're looking to get a translation done, then I also send them the link and they can request it, where they put their language, how many words, just any kind of comments that they might have for the translation vendors. And I make sure to be the middle person. So I will go ahead, take the request, create a quote with our translation vendor. Once the quote is approved, it comes back to me. And since we would be using my funds, I go through the whole procurement process of getting funds approved and getting it processed. Once the funds are approved, then I go back to the vendor and give them the green light to go ahead and get started on the project. Once the project is completed, or if they have any questions for the clients, any transcreation questions, specific lingo, these things, I will serve as the middle person and communicate back with the community service board or with any of the DBHDS staff. And we will work together. And once it's completed, I just send it over. And that is the complete process. And it can be a little daunting. So what I did was I also created a step-by-step process, kind of like one pager that explains what each step looks like. So we have those readily available as well. And how do we ensure translation accuracy? So for a lot of the translations, depending on the language, we are also able to contract reviewers. So for example, if someone requests an Urdu translation and they would like to have it reviewed, then I will refer them to a reviewer who will go through it and make sure that it is accurate. Now for Spanish, I have tended to do it myself because I do speak Spanish. So I have tended to do it myself or other people on hand, usually within their staff who are also interpreters, have gone through it. But to ensure the accuracy, more than likely there is a reviewer behind it as well. Someone who is trained in translation or someone who is fluent enough to know the lingo and to know, you know, all the regionalisms and just everything that might vary the register, just to make sure that it's good. And languages that we usually translate to right now, very popular: Spanish. We've had a lot of Arabic, a lot of Pashto, Dari, Tigrinya. We've had a lot of Ukrainian, and just a lot of languages that are not just Spanish. And we keep seeing more and more languages popping up. I think I just had a Haitian Creole translation recently that I didn't have before. So that is our main process. And again, this is within my office that we have decided to do it this way to cater to our 40 community service boards. I'm not exactly sure what the process is for the facilities, or if we were to have a language access person statewide, if that process would change. But for now, this is the process that we've been having, and it's available to anyone within the DBHDS system. Our staff who run the programs at central office, but also our community service boards.
Nice. Nice. Thank you for sharing. When I first talked to you and you mentioned the Google Forms, I thought that's such a brilliant idea, because you know, for our program we have an email, but I think that having a form where you can eventually export that information automatically, that saves a lot of time. So I thought that was brilliant. Hopefully we might get your idea someday and implement it at DMAS as well, because I thought it was very neat. Anna, tell us a little bit more about VDH. How do you guys handle translations?
So at VDH, I could say that we have like two teams, right? We have the in-house professional translator that is one of them is Jose Jimenez, who is in the audience today, and myself. And then we handle the day-by-day Spanish translation, but we don't have the capacity to translate everything. And then we have the translations through the vendors, the outsourced. In-house translator, we have created a form that get the minimal information for us to understand what is the request. Obviously, all is for Spanish. We like to know who is the audience, the number of words, and any information that is important for us to understand where this document is going to go. And as well is by doing this with the form, it's wonderful because you can cap all this data in different ways. We get an Excel document, we put our notes on the Excel document, we know when it's due and when it's returned to the customers. As well, we have created like a little workflow for our internal process for the, it's more like educational for our staff to understand what is the process. So there are three components. Yeah.
I was going to share because I have it on the slides. This is what you're referring to, right? Yeah.
Yes, exactly. This is this is what I created when I first started as a translator, because I think it was important for our staff to understand the content of this process. You need three more partners: the requester, the project manager, and the linguist. The first thing we need to do, obviously, the requester assess the need. What is the document that is plain language, that is 508 compliant, all these different parts. Give it to the project manager. We assess, we study time, we will go back to the requester. We done, then we can start the translation process, which is create a project on our software or the CAP tools. You probably are familiar, a lot of you are familiar with this. We have MemoQ, Trados, and we are using specifically SmartCat, which is a program that helps us to divide our translation exactly similar to what you showed before, Montserrat, with the 3 columns. This program divides in segments. So it's very easy for us to work on the projects and the translation. Sometimes complex vocabulary. It helps us to keep translation memories, which is basically like a database where the program will tell us, you have used this term before, you have used this sentence. So that means that we're going to be very consistent on our form and our vocabulary. We can get results from that translation in 2 forms. We can get the final result in Spanish, or we can get a bilingual part, which will be a column in English and a column in Spanish. Sometimes we use that product because the type of document is complex. It's a PDF, you know, it's difficult to work with because it's work on boxes. So sometimes we produce this bilingual and give that to the requester so they can take the appropriate block or segment of the language in the appropriate design. The linguist and the project manager work together. We review each other's work, and we follow what we call the TEP, which is translation, editing, and proofreading. Each step, we do a quality control. Once this is finished, and we have to do sometimes formatting as well, and we need the help of our, what is it called? My goodness, I'm missing that word. The designer. Then we review, we send it to the requester. If the requester has any questions about it, it comes back to us and we work on the suggestions or the changes we need to do. Okay, so that is the internal process. For external, we had vendors. At this moment, we have the Omnia contract, which is a contract with the general services. It has 12 vendors. Then we have Propio until April 2025. And then we got a new cooperative contract that we are very excited about with the language group. That is a beach-based company, which means that the manpower is in the state, which is very interesting for us. We have instructions on how to request the services from these vendors on what we call our Language Access Hub, because this is one of the things I realized that we need the most when I first started in this job. There was not a centralized place for our staff to go and get instructions, pricing, everything at one click. So we created the Language Access Hub.
Anna, I'm sorry to interrupt. I'm just reading some comments on the chat that it looks like your audio is going in and out. Might be connection. Maybe if you turn off your camera, can we try that? See if the audio flows better while you're presenting.
My apologies. I'm sorry. No? Can you hear me? Can you hear me better now?
Yeah, let's try it. It just once in a while it drops in and out, but yeah, let's try it.
So we have the Language Access Hub, and it's the location where our staff can find instructions and pricing on the different vendors that can provide the different language services, translation being one of them. And they will have comparing prices, instructions on how to upload the portal. We recommend as well to get several quotes when the project is important and large, because you will be very surprised where the final price is. When you have a big project, please ask several of your vendors. It's free. Just get a quote and you will see that you can save a lot of money, you know, obviously with a good quality. So that's what we do on terms of the process. For the quality control, obviously for Spanish, quality control, some of the campaigns to be reviewed by us if we have marketing campaigns or seasonal campaigns, back to school, vaccination, etc. We review it, even audios as well. radio, social media. All those we can review it at home, in-house. And then as part of our language access and disability plan, we are implementing a quality assurance process. For example, gathering feedback from our clients when they get a translated document. But this is still in the process, as I've said. In languages, as you know, it's going to vary depending on the area of the state. I hope I answer all your questions.
Yeah, definitely. And it was very illustrative, especially when we share. I apologize. And I experienced that too, some drops in the audio. I don't know if there's anything you can do to see if we can get a better connection. While I ask Zoe about, not sure if that's, if you have, Zoe, a process in place or if you handle translations. Tell us a little bit more about how your agency, if they do, or you probably, I don't know if you handle those translations directly.
Yes, so I definitely do handle our translation requests directly. I'll also note that this is strictly written translation. Our interpretation is a completely different system. Typically, our staff who are bilingual will, and yes, please let me know if at any point my audio starts getting difficult. I live out near a rural area, so that can happen sometimes. But the at our organization, it's community-based, and our capacity, like any nonprofit organization, can vary. So typically with interpretation, our bilingual staff can take care of that based off of their programs and based off of what roles they have in their program. But for translation, since our organization tries to reach different languages, we have a completely separate system for translation. And as much as possible, we don't have our bilingual staff do the translation requests unless it is that specific bilingual staff's language for their own program or project. So otherwise, we will typically do external translation. And for that process, what we do is pretty similar to Guadalupe, where my staff will send a Google form request to me about the translation that they want done. They'll send me the document and the languages that they want. We have a list of community translators that work with us. Some of them are volunteer, some of them we pay ourselves, and we have my teammates have personally gone through and vetted the quality of their translations, and we've also used reviewers, and we interview each translator and reviewer just to get a sense of their skill and if they can do translation for the different programs that we have. For example, for our civic engagement work, it's nonpartisan, which requires specific legal wording for to make sure we're not endorsing any particular candidate or party. And for our health work, we make sure that our information is compliant or at least consistent with, let's say, Virginia Department of Health. So we'll need translators who are able to do that, and we'll need community reviewers who are able to kind of understand that context. So once my staff send me the request, I will typically go to our translator roster and figure out, okay, who is available to take on this request? What is the timeliness? To what level of, how much of the legal jargon needs to be reviewed? And what is we'll work with everyone based off of either word count or the number of words that is in English, since different languages require different grammar and different spelling. So for instance, Urdu, we cannot do based off of per letter. It has to be per word in English so that the translation can come through properly. And so once we select the translator, select the timeline, and then send out the translation request, we'll typically, depending on the project, we'll have the reviewer review, and then, or if we've worked with a translator for a long time and they've had generally good experience and we've had reliable experience with them for a specific program, we typically trust the quality of their work. In addition, community members, we've had instances where community members will give us feedback on the translation. So if something is not good or it's confusing, we will pretty much hear about it immediately. So that doesn't happen as much as it did when we first started, but we've definitely come up with a more reliable system. And then for languages that we don't have translators for currently, we will typically seek out translators, or we will work with our community partners to see what is available. So that's also why translation at the Virginia State Agency level is really helpful, because we will actually typically send out that information from the state agencies, since communities tend to trust the state agencies. I know that might be a little counterintuitive for some people, but for information, especially with the amount of misinformation and disinformation out there, a lot of community members will typically look at the state agencies for resources, because that's the most reliable place they can think of. So that's why it's also really important for us to know that there is information available, because they'll also be more likely to trust us, or at least have us explain what everything means, if they know that this is coming from a reliable source. So that's another challenge and issue that we've run into with our translation accuracy. And it's a way that Virginia state agencies do really help community organizations in Virginia.
Great. Thank you. Yeah, and the usage of community members, I'm so great to hear that you're able to utilize them, because there might be also some languages that might be more limited, and having community members work with you guys and volunteer their time, it's great. So I'm glad to hear that strategy you guys are using to get collaboration from the community members. This is great. All right. So we're hitting the last two questions for our panel discussion. And as always, when we work on a project, we have some learning lessons. So I will be curious to learn from all of you what challenges or barriers your agency has faced in providing translation services, and how you've overcome them. I'm sure we all have stories to share. So let's start with Guadalupe.
Yeah. So as I mentioned before, I think one of the biggest barriers right now is that we don't have a language access plan. So we don't have something centralized or for everyone to kind of find a bit more of direction as to what the instructions are surrounding language services in general. But we are slowly working on it. Currently, we are conducting a needs assessment through my office within the community service boards. And what we're trying to figure out is a baseline of where we are at surrounding language services, what has been working for them, what hasn't been working, what systems are in place, if there are any at the moment. The hope is to take the data from this needs assessment and to leverage it with DBHDS and allow them to see the data and to get a perspective as to what is going on with the people in the community service boards, the staff, the clients, the people coming to receive services at each community service board. So our goal is to use that data to eventually create a language access plan that will be used agency-wide. So that is where we are at right now, amongst other things like creating these small structures for translation and hopefully interpretation are some of the ways that we are trying to overcome this barrier.
Right. Yeah, a lot of listening into what's out there to get better, right? We need that feedback to implement better projects. Thank you. Thank you for sharing that information. Zoe, any challenges you have particularly run into, and information on how you overcame those challenges?
Yes. So from the community side, especially since we do work with some Virginia state agencies, sometimes the challenges or barriers are just knowing the limitations of the state agencies. So I'll be a little bit generous too and say I have worked within a Virginia state agency and a local state agency as well. So I'm a little more empathetic, especially, and I have a better understanding than the rest of my staff or other community stakeholders and organizations to what the reality is about working or providing these services for the whole state. And so sometimes it's just knowing what those limitations are and the places where community organizations can be supportive. So for instance, my organization may not be able to provide quality translations for Virginia state agencies, but we can provide outreach. Or in this case, my organization does do legislative advocacy. So I know that's also something that Virginia state agency employees are not allowed to do as state agency employees. But if there are issues such as funding issues or, programmatic support or capacity that are, things that the state can do, but we'll need to move legislators on it. Community members they just don't know what that's like on that side. So if they know, oh, okay, we are missing this data, or we need a commission to help us collect this data or approve this data collection, then that's something that community members are like, oh, I didn't know that that's something that the Virginia state agencies would need. Maybe we can help. Or on the other side of it, it's also knowing, let's say we did a lot of investigating on Title VI and what the actual, the standards are for language access in Virginia. So kind of having that information and sharing it out are the ways that we kind of overcame this or tried to figure out, it's not just, let's say it's not just on the Virginia state agencies to be providing everything they can if they don't have the resources or the support to do it from the state or even from our General Assembly or the governor. So those are things that communities like to know and things that they can help with when they actually know that information. And I think with our internal agency, I think the biggest challenge is just that there are so many languages in the Asian community. And so, sometimes it's providing spoken interpretation, sometimes it's providing high quality translations, and being able to do that within our capacity. We hate to limit our ability to provide those languages, and it's hard to prioritize, especially when the question is, are people not coming because the language isn't available, or do they not need this language because someone else is providing this for us? So a lot of it is about information and understanding where our role is. And so some of it is trial and error, but some of it is just working together with partners like you.
Yeah, perfect. Thank you. Very interesting point. Anna, let's try your audio if it flows a little better, but I was curious to see if you have any challenges or barriers that you have run into at your organization and how you've overcome them.
Sure, please let me know if my audio is better right now. So there were two important challenges for us. The first one was the finding the directions on how to request translation services. There was not a place in the agency where our staff could go. And we solved that by creating the Language Access Hub, where you have that information. And the second problem, the big problem, was depending on somebody else's language service contract, in this case, the Department of General Services. This has been a very difficult time for us because this contract, while not mandatory, is certainly recommended because it helps to streamline the procurement process. But the Omnia contract was approved November 1st, 2023, and was not being implemented until March 2024. We were at a moment where our ability to provide language service was maybe compromised, and we didn't want to rely on waiting for them to tell us that we can use that contract. So to solve that situation, we asked permission to use Propio as our sole provider. sole source provider, which was pretty much our biggest vendor for language services. While this was getting approved by DGS, we find out about this other cooperative contract between the City of Virginia Beach and the language group. A cooperative contract means that it's a contract that has already been agreed upon this part, but it has the cooperative verbiage, which means that any agency in the state could use the services already agreed. But to do so, again, we have to go through DGS, explain why we need to access that contract. And well, after several steps, we finally got approved. At the same time, ORNIA would finalize. So all together, we are now having OMNIA contract with 12 vendors. We have Propio, and then we have the language group. So I think that is very beneficial for our agency to have all these options.
Yes, vendor contracts are always a challenge for a state agency. So I'm glad that this somehow got resolved, and now we have plenty of options with contracts out there that we can use. So we are towards the end of the panel discussion, and just to see if we can leave a few minutes for questions. I'm just curious for closing words from each of you, if you can dedicate like a 30-second comment on what would be your advice to an agency that doesn't currently have a process in place to handle translations. What would be your wise advice to them? Guadalupe?
In 30 seconds?
Sure.
Create a centralized hub, something centralized. Having it centralized will make your life easier. For requests, it's there. Data, it's there. Evidence, it's there. Just everything that you need. As long as you have it centralized, it's going to be your best bet. Some kind of a system where it's easily accessible and you could easily come back to it. That would be the biggest thing. It's definitely been a lifesaver for us.
Great advice. How about Zoe, for you, what will be your advice to those that are trying to start a process?
I would say start where you can. So data is a huge one. Even if your agency doesn't have a specific data set that you can use from your services, you still have people that you're working with. And I know that some federal grants mandate that you collect demographic information. That can still be a place to start, even if it's not the complete place. It gives you a baseline. So establishing that baseline for your information can be a really strong foundation for anything that you implement, whether it's about your translation process or if it's about expanding your language needs or so on. But having that baseline of information will be critical, not just for you, but for other state agencies and organizations like me.
Yeah, very important tip. Thank you. Thanks for sharing. Anna, what would be your advice?
Just simplifying everything I said. Assess the needs, which will be what documents, the volume, the language. Establish a guideline, how the process is going to go. Train our staff. It's very important for them to understand what a translation means. Monitor and evaluate how we're going to get input from the stakeholders and the clients. Identify the resources. Is it going to be in-house or is it going to be through outsourced services? And lastly, prioritize the materials that need to be translated. Frequently used, emergency documents, and so on.
Yeah, the priority, you got to start somewhere, right? I wish we could do everything we could, but we have, as you all explained, limited resources, limited people, limited budget. So the priority tip is super important. I agree with that one. Well, thank you all. This has been very interesting. I have learned a lot of new things, and I wish I can start implementing right away for our agency. I hope others have also learned. But let's see if there's any questions. Jesus has been keeping track of possible questions that may be addressed to the panelists or to the presentation. Jesus, is there any questions? Maybe one, because we're running to the last 5 minutes.
Montserrat, we received some comments related to the Medicaid program, but they are not about the topic that was discussed today. So I will send you those comments to discuss later. There is only one question for you from Carla Francis Jones. This person wanted to know if the graphic of the increasing trend of non-English languages included ASL. That was the question.
So the graphic of the increasing trend for Virginia Medicaid?
Yes, it was the slide number 8, I think so.
Yes. So for the Virginia Medicaid language counts, we do include American Sign Language as one of the languages. So that would be included as the non-English language. So the answer is yes, it would include American Sign Language as well. Thank you for pointing that one. Very, very important, as it's very important to also track the usage of American Sign Language to see how we can provide language services for American Sign Language interpretation. Well, those questions that you have received, Jesus, make sure that I get them. If they're not to today's topic, we'll be happy to address those. I also wanted to thank everyone who registered to the event, who has given us some ideas and thoughts about what future conversations we could have. That's been very helpful. It's been very helpful to learn about each of you. What type of work do you do for language and disability access, and what are your priorities, and what you're trying to learn more about this whole new realm of language services to provide. So thank you very much, everyone who joined. Thank you to my team. Thank you for the panelists for your time and dedication. Thank you to the keynote speaker, Craig Marva, to take some time of your busy schedule. It is an honor to have you all today here. And I hope, and I'd like to end that it is evident from our conversations that language and disability access services are very critical components of our work across state agencies and across organizations in our community. So I hope that all this information, this wealth of information has helped every one of you somehow, somewhere, and that new strategies can be implemented so individuals with limited English proficiency and people with disabilities are better equipped to access our programs and services. Very interesting conversation. I thank you all. If you have any questions, please let us know. We have put here the Civil Rights Coordinator email account, and we will also be in touch soon within the next couple of weeks with all the materials that have been presented today, including the recording. We will be sharing that information soon. Thank you very much. It's been a pleasure to be here today, and I appreciate everybody's participation. Thank you.